Hey guys, welcome back. Today I'm super excited to take you on another journey with my own skincare and self-experimentation. Previously, I've done spray tans, I've done sugaring, and other things that you guys have been able to follow along with to know the types of things that I'm doing so I can educate you about it. Well, today I'm going to be doing my first resurfacing laser treatment on my face. And a resurfacing laser is something we talked about a little bit in other videos when I've talked about lasers, and we talked about it for acne scars. And I'm going to be doing a fractionated laser treatment, one specifically called Halo, and I'll explain a little bit about what that means. But this fractionated treatment can accomplish a few different things, and it's going to be, for most people that are getting it done, they're going to be working on fine lines, wrinkles, pigmentation, and thankfully I'm using it more as a preventative treatment. I have a little bit of old pigmentation from days when I wasn't very good about wearing sunscreen, and the laser is going to help with that, but overall just rejuvenate, even out the texture and the tone of the skin. This is not something that everybody should be rushing out that you have to do, but I have it available to me in my office because I offer it to patients, and because I'm going on to Christmas break, then I'm going to be, this is my last day in the clinic for the year, so I've got some downtime where I can go through a procedure and have time to recover. But what I want to do is take you guys through the process, not only of the procedure itself, but of the recovery, what that looks like, immediately after day 1, day 2, day 3, when I'm back to wearing sunscreen and things like that. And I'll explain the whole process as we go. Now, let me talk a little bit about the Halo laser. So Halo is a hybrid fractionated laser. We talked about fractionated lasers in other videos, how it distributes the laser energy into small columns, but leaves normal skin in between those beams of energy. And that normal skin is what helps you to heal more quickly. So the downtime is much less with a fractionated treatment, but you can still get really good results as far as a reduction in lines and wrinkles and pigmentation. But you don't have to go through the weeks of downtime of a fully ablative resurfacing laser. Halo is a proprietary name owned by a company called Cyton that happens to be the laser that I have in my clinic. I did a lot of research before I purchased this laser. It was one that I felt could be a workhorse in my office, that could be very versatile and really serve the patient population that I see very well. So I have the Cyton Halo laser, but I can change out the handpiece to do more aggressive fractionated treatments or even fully ablative treatments. And it's got a handpiece on there for something called BBL or broadband light. And it gives me a lot of versatility in what I treat my patients with. I have done BBL treatments. Some people might call that an IPL treatment. BBL is a Cyton name, so again, that's a proprietary name, but other companies have similar devices, which would be IPL or intense pulse light. Not a true laser, but it does use light energy to help rejuvenate the skin. The Halo laser is a true laser, but it's a little different than others because, as I mentioned, it's a hybrid fractional laser, which means it has two different lasers in it that are delivered to the skin in the same hole. So it has an ablative laser, which is that erbium laser, and that actually does a little bit of damage to the surface of the skin. That's what you can see immediately after the treatment, the tiny little holes that are made by that ablative fractionated laser, which is erbium. The erbium laser is at 2,940 nanometers at 2940. It's very good at targeting water in the skin. Of course, we have a ton of water in our cells, but it also delivers a non-ablative laser at a wavelength of 1470 nanometers. And that non-ablative beam is put right in the middle of the ablative beam. And so you can get both energies delivered to the skin at the same time, so you can get some deeper heating, but the ablation also on the more superficial levels. And together, you get a really great treatment that is really something you don't have a ton of downtime from. And now, my job here is not to sell you on going out and getting a Halo laser. I am doing it, I'm excited to do it, but I want to show you that whole process of what it's like and how that might compare to other treatments like microneedling or dermabrasion or dermaplaning or different things. So this is going to be a little bit more aggressive treatment. I'm going to have a few days of downtime with it, but you're going to see what those images look like. I'm excited to show you, so let's go check out the laser. Now, before I do my laser treatment, there's a couple things that I need to do in advance of that. One is I want to get some numbing medication on my face because the laser can be uncomfortable. So what I'm going to do first is clean my skin. I want to remove the sunscreen that I've had on for the day. I want to get off all the dirt and oil and anything else that has gotten onto my skin. And then I'm going to use some alcohol and some acetone to help remove all of the excess oil that the cleanser doesn't get. Now, obviously, that's a little bit harsh on the skin, but it's necessary in order to help that numbing medication to penetrate into the skin adequately. Now, if you're using numbing medication before a procedure, it is important not to use too much. It is possible to absorb enough lidocaine through the skin that can lead to toxicity, and unfortunately that's happened at med spas from time to time. And so you have to be careful that just because it's topical doesn't mean that it can't get into your body and potentially cause adverse effects. So I'm going to be very careful about the amount of topical lidocaine that I put on because it's a high percentage lidocaine cream. I'm going to put on one layer and kind of rub it in, and then put on a second layer and kind of leave it on top of the skin so that it can work for a little while. I'm going to have about 45 minutes of numbing before I do the procedure to help keep me really comfortable. So we're going to wash with a very gentle cleanser and then go through the other steps. So we're going to clean really good, rinse that off. So now that I've cleansed my face, we're going to take a little bit of alcohol and just degrease, just to make sure everything is getting off. And we'll use a few of these, removing extra oil, any bacteria, everything that we can get off. Stings a little bit. I have sensitive skin. This laser should help with the appearance of pores as well, which is, I tend to have a little bit bigger pores around my nose, so I'm excited to see how that does. The next step is I'm going to use a little bit of acetone, so I'm going to put gloves on for this one. It feels very cold, it's very volatile, so it evaporates quick, makes your skin feel very cool. But it's another good way to help degrease the skin. It's going to make my skin really dry. Talk about wrecking your skin barrier. Let that evaporate. Okay, now the next step is to put on the topical numbing cream, and this is going to be a little bit different from office to office as to exactly what they use, but as I mentioned, you do want to make sure not to use too much. So I'm going to use a tongue depressor to scoop this out so we're not dipping fingers into there. And again, I know about how much I'm using there. So, and this first layer we're going to rub in pretty good. So I want to make sure I get all the way to the angle of the jaw, everywhere where that laser is going to go, across the upper lip. And I've covered myself pretty well, so we're going to take the rest of it and just kind of not rub it in so much, just let it sit on top of the skin. Now, one thing that can be done also is a little bit of occlusion where you put saran wrap over the top, and again, that's just going to help penetration of it, so that's something you have to be careful with. Do at the direction of your physician. So I can already feel it starting to work. It's getting a little bit cool. Now we're going to wait about 45 minutes and I'll be ready for my laser treatment.
So you can see as I'm having the procedure done that the Halo laser is this handheld laser attached to the larger box which plugs into the wall. And this is rolled carefully across the skin, and there's two little roller wheels on there. And as those go by, it tells the machine to fire the laser. And if you go faster, it'll fire the laser faster. If you go slower, it'll fire the laser slower. And before doing the procedure, the face is mapped out so the laser knows how much it needs to fire to properly treat the surface area of your face. Because once you put in the settings, you don't want to over-treat the face and you don't want to under-treat the face. So this mapping it out, measuring the surface area, and precisely calibrated measurements will then help to deliver the proper dose of the laser energy to the skin so you get the result that you're looking for.
I believe.
Whew. Okay, so this is day 1 after my halo procedure. If you look close, you can see I've got little tiny dark spots forming on the skin, kind of like flakes of pepper. And this is normal. So this is the damage that the laser did, and it slowly starts coming up to the surface as the skin cells change, and they'll begin to fall off. It's important not to try to peel them off as it happens, just let it happen naturally. So how did I feel after the procedure? I was probably feeling like really warm and uncomfortable, not really uncomfortable, but for a couple of hours. I did go home and took some Tylenol. I continued to spray down with the thermal spring water, and then I was applying some Aven Cicaplast balm for 2 or 3 times before I went to bed, and then I slept with that. So the Cicaplast balm is just very hydrating, very healing, and you want to make sure your skin doesn't dry out when you're recovering from a laser. So this morning when I woke up, I did gently clean my face with water and a Cetaphil gentle cleanser, just very bland, very mild, not going to deliver any actives to the skin, which I don't need at this point. And then I patted dry very carefully, and I did feel a little bit tender as I touched my face with the towel and while washing, and then I applied some Aven Zeracalm, the balm here, the Tolerance Collection. So this was really soothing as well, but it's not quite as heavy as the Cicaplast. And then I'm going to be putting on sunscreen before I go outside. But essentially, if I'm not touching my face, there's no pain this morning. It's very comfortable. And this is just, you can kind of see what it looks like as things start to flake off here. You know, really for just a couple hours of discomfort, it's going to deliver a great result. I can already tell. You can tell I'm a little bit puffy, a little bit swollen. So I'm on track for a really good result. All right, so this is day 2 after the procedure. Today is Saturday. It is Christmas, so Merry Christmas. And I'm just doing a quick update here. So what I can see today is that I'm getting a little bit more coloration coming up. So the spots are getting darker as they continue to come up to the surface. There's not really any pain at all today. Even putting additional moisturizer on my skin did not cause me any issues today. I just washed gently with water today. I did put on the Elastin Nectar. I don't think I mentioned that, but I've been doing that every day since the procedure, as well as continuing to moisturize with Aven. You know, during the day I'm using the Zeracalm, and then at night I'm using the Cicaplast, and I'm using a little bit of ointment during the day. The CeraVe healing ointment is what I've been using, just to make sure that I'm not drying out at all. And the skin has stayed really comfortable. Everything feels really good. I'm not going to shave for a couple days. You can see that coming up on the forehead too. And just so I don't irritate the skin, so I'm not going to shave. But things are going really well. Again, really all the discomfort was during the first couple hours after the procedure, and everything has gone just amazing since then. So just kind of see everything kind of darkening up, and all of that is going to fall off and just be a lot more smooth and give you, we call it the halo glow. So everything's going to be just more uniform color, so removing unwanted pigmentation. But day 2, everything's going great. You can see the progress. Here we are. Okay, today is day 3 post-procedure. So I had the procedure done on Thursday at the end of my workday. Friday, Saturday, and today is Sunday. So this is the 3rd day afterwards, and you can see that I'm really getting a lot more of these little brown spots coming up all the way down through on the cheekbone here. You can't see it quite as much through the facial hair, but I'm not shaving right now just because that would risk irritation, but I'm getting really dry here. I just cleansed my face and showered, so it's definitely time to put on all of the moisturizers and everything. It feels like sandpaper when you run your fingers across it. Definitely kind of an interesting feeling to feel on your face. So here's the routine that I'm going with today. Now that I just cleansed my skin, we're starting with some Elastin Nectar. This is very good for post-procedure. So we're going to put just a little bit of this on. And this in and of itself is not meant to be a moisturizer, but this delivers different actives to the skin, growth factors and peptides that are supposed to help improve your healing, improve the results that you get. And Elastin has some good data on that product. There's no pain as I rub product on my face today. So everything is covered with the Elastin Nectar now. And probably tomorrow, a lot of this is going to peel off. I definitely feel more of it today, which means it's lifting even more up to the surface. and is just about ready to come off. Now that we've got the elastin nectar on, I'm going to put on a moisturizer. So I'm using the Event Tolerance Control. I've been using Xeracalm the last couple of days. I do like Aven. This does come in a sterile pump container, and this was gifted to me by Aven, and I've done partnerships with them before. This is not a partnership, however. I just like the product. So we're going to put that on to get a good moisturizing layer on the skin. The balm is going to be a little bit heavier than the cream or lotion, and I want something that will sit on the skin for a while. It definitely looks like I have a tan or a sunburn, but we don't want the skin to dry out when you're recovering from a laser or a chemical peel. You're going to heal way better if you keep it moist. And throughout the day when I'm home, I'll be putting on some CeraVe healing ointment as well, especially around the mouth where I'm tending to get a lot more dry. We're going to let that sit for a little bit, and then we're going to be applying the Mantle sunscreen today. I am going to be going out of the house today, and I want to cover up. I like the Mantle sunscreen because it's a little bit hydrating on my skin. It's a gel, it's totally clear, not water resistant, and it is a chemical sunscreen. Early on, I wanted to use a physical sunscreen, just less stuff going on my skin, especially when those little microchannels were more likely to be open, but now everything is closed up and it's just lifting off the surface. So I am going to use a chemical sunscreen. The Mantle sunscreen I really like, totally clear, transparent, and won't cake up in facial hair or anything like some of the other sunscreens will. Now, because of everything else I've got on my face, it's making me look a little more shiny. I'm okay with that because I already don't look great because of the procedure, but usually I like Mantle because it does leave a matte finish. And this will be fine just for running a couple quick errands today. But if I were going to be spending significant amount of time outside, I would either wear a visor or a physical sunscreen that would leave a white cast. But for just a quick trip in the car that I'm going on right now, this is going to be sufficient to protect my skin from ultraviolet rays. But I would want a thicker physical sunscreen if I was going to be outside for extended periods of time, still with this on my face. So that is day 3. We'll see you tomorrow. Okay, so today is day 4 post-procedure. It is Monday. Again, had the procedure done on Thursday, and we are getting a lot of flaking. It's very dry right now. I just washed my face, but you can see all of these dry flakes around the nose, around the mouth. Everything feels like sandpaper. I used an electric shaver to trim last night because it was getting a little itchy. So that's where we're at today. Keeping up with the same skincare routine, using the elastin nectar to go on first. Then I'm using the Event Tolerance in the morning. I'm using Cicaplast at night. And then today I'm going to be doing a little bit higher sunscreen level, the Anthelios 60 from La Roche-Posay, because I'm going to be spending a little bit more time outside, so I want good protection out there so it's water resistant and everything. Overall, very happy with how things are going. Again, no pain, just dry, just a little bit tight. So we got to help repair that moisture barrier as all of this flakes off. But I'm loving the results so far and excited to see what the next 24 hours are going to bring. There are lots of changes over the last 24 hours, and I think the next 24 hours are really going to pull a lot of this stuff off. So that's where we're at today. Okay, so here's day 5 after the halo procedure. I'm traveling today, so I'm in a different recording location, so the lighting might be a little different, but hopefully you can see that the central part of my cheeks are pretty much done peeling now. It's very smooth, and I feel like the pigmentation is reduced in that area. It's still peeling a bit around the sides and the forehead, around the nose, and still a little bit dry around the mouth. But it feels great. It's a little bit dry, a little bit tight, so continuing to apply moisturizer all the time, essentially following the same skincare routine that I've been outlining on other days. But there's no limitations to my activity. I'm going to be working out later today. So pretty much back to normal, other than the skin's a little bit dry, so just managing that until it's done peeling. I imagine 1 to 2 more days, but definitely over the last 24 hours, I experienced the most part of the shedding over the face. So almost done, very happy with how things are going. Overall, very low downtime procedure. Grateful that I did it over the Christmas break, but you could do this, stay home over the weekend, and you could be back at work. I don't think there'd be any problem with that the next week. So that's where we're at now with the recovery from the halo procedure, 5 days out. Today is day 6 of Halo recovery, so this is probably my last of the daily updates. The next one is going to be when everything is completely done. Peeling, there's just a little bit left flaking around the hairline, a little bit on each side, but most of the forehead and the cheeks are completely clear at this point, and the skin is starting to feel less dry, still a little bit dry around the mouth, so keeping up the moisturizer. But once you have gotten to this point of Halo recovery, the most important thing you can do to protect your investment is to wear sunscreen on a daily basis. The Halo is going to help take away a lot of the damage that you have had done over the years when you didn't wear sunscreen. But anytime you do any energy-based treatment, you need to protect that investment, and that's where sunscreen comes in. It's an inexpensive way to protect your skin from further damage. So pick a sunscreen that you like using every single day and make sure it gets on, and then reapply as often as you are able to. I know that's sometimes more of a challenge, especially if you wear makeup. If you wear makeup, look for powdered sunscreens. We have some of those with 208 Skin. So overall, highly recommend the Halo treatment. I still have a little bit of pigmentation. It doesn't take away 100% of everything. I could probably do a couple more treatments over the next few months, but I'm not going to. I'm just going to probably make this a once a year type of thing for me, and very happy with the results. So let me know if you guys have additional questions and I'll answer them in the comments. So now that you've seen me prepare for the Halo procedure, have the procedure done, and watch my recovery for the first 6 days, you may have some questions, and feel free to leave those in the comments below. I'll try to answer as many as I can. Now that it has been a little bit more than a week since I had the procedure done, here are some of my final thoughts. First, the procedure was really very tolerable during the procedure. I had almost no pain except for a few small areas, and then I had some warmth that felt like an intense sunburn for probably 3 or 4 hours afterwards, and it did dissipate over the course of that 3 to 4 hours. So it was the most intense in the first hour and then gradually got better. I did take some Tylenol when I got home to help, and spraying down with the mist did help quite a bit. I didn't think that I was very swollen the next day, but as I posted some videos on social media, followers let me know that I was indeed swollen, maybe a little bit more than I thought. The swelling really was not too bad, and the way that my skin felt didn't necessarily limit a lot of my activities. Now, I wouldn't encourage a patient to do a whole lot in the first few days following a laser procedure, but I was able to play with my kids with not a lot of intensity. We were able to have some fun because they were on Christmas vacation. So I really didn't find that the downtime was very burdensome for me, but I certainly would not have been working out, and I didn't work out for a few days or do a lot of heavy lifting or get into anything that would be getting dirt and stuff on my face. I cleansed gently. I applied tons of moisturizer. You saw that in those daily updates, and that really helped for all of those little specks to flake off of my skin, and I'm incredibly happy with the result that I got now that it's all over. I definitely noticed that my skin is brighter. I have what they call the Halo glow. Now, if somebody hadn't seen me in a long time, they may not notice a huge difference, but having seen my skin immediately before the procedure and then what things look like after all the peeling had happened and the swelling went down, I definitely noticed a difference in the quality of my skin, and it really has motivated me to reapply my sunscreen during the day, because I'm really good about putting it on first thing in the morning, but I'm not always great about reapplying it. And so now that I've invested in my skin a little bit more by going through a procedure that had some discomfort, I really want to take good care of my skin. So I'm using sunscreen in the morning and doing a much better job about reapplying during the day. If you're thinking about having the Halo procedure done, I do encourage you to have a consultation with a dermatologist in your area. If you're in the Boise area, definitely come in and see us here. But it can be used in the young and in the older. It's really good for fine lines, wrinkles, pigmentation. The settings that I did on my skin were definitely geared more towards helping to alleviate pigmentation rather than correct a lot of lines and wrinkles, because that wasn't a concern that I had going into the procedure. I would definitely repeat this procedure. I may do it again over the next Christmas break, and it can be combined with other laser treatments like a BBL procedure. At some point, as I get a little bit older, I may go ahead and do a more aggressive resurfacing laser treatment, but I just didn't feel like I was in need of that at this time. Overall, I highly recommend the Halo procedure. Make sure that you're getting that done in a place where it is performed by or directly supervised by a board-certified dermatologist, so that you know that not only are you going to get treatment with settings that are going to be appropriate for you, but that if, heaven forbid, there are any problems or complications, you're with somebody who knows how to handle those complications and can help walk you through them. Because unfortunately, adverse events do occur even when everything is done perfectly, because we're human beings and things sometimes just go wrong. So I highly encourage you to seek out a board-certified dermatologist if you're considering a laser procedure of any kind. So again, if you have questions about the Halo treatment, about my recovery, or my thoughts as to why I did it or when I'll do it again, leave them in the comments below. I look forward to seeing you back as I do more self-experimentation through 2022 and learning together. Have a good one.